Yo, my people, it's Sharif Pantha. This is the second episode of Everything's Health. Today, obviously, I have my co-host with me, Mims, the female Morpheus, the lovely voice everyone's been asking about. And today, I have my first guest, which I'm really excited about. We've just had a whirlwind of a conversation, and I'm really excited to where this is going to go. I have my good friend and physio, Alain. So if you go give him a round of applause.
Thanks for having me, Kiefer.
No worries, no worries. I'm sure we're going to go into the mountains in the back in regards to the broad subjects we can sort of touch on, but just for the benefit of everyone we're watching, can you talk us through your qualifications and credentials, everything from school time and up until now?
Good. In brief. Well, I was originally a professional dancer. I came to London to train as a dancer, and I trained here and I trained in New York, so finished my undergrad there. Then performed for quite a number of years, mostly doing musical theatre and, and things and pop videos and all the rest of things like that, commercial work.
You're playing that bit down, pop videos, what?
Yeah, well, yeah, okay, I did dance with Kylie. I did tour over the world, but anyway, but it's when you're young, it's great, see the world and work and be on stage. And then I finished that. Actually, after performing for some time, so I just realized, God, every day at 9 o'clock in the evening, I know exactly where in the world I am, which angle my head is turning, what I'm saying, what I look like. And every day at 9 o'clock, I knew what to, I thought, surely there must be more to life than that. I felt brain dead. Yeah. And that's how I thought.
How old was you at this point?
I was 26 or something like that. So I thought, I need something else. And I think come to a point, something was talking to me and say, I need something else in life. And then I thought I need to use my brain a bit more. And then I started studying. So, and then I decided, what do I want to do? I like a lot of exercise and stuff. So, and when I was dancing, and I always used to learn to help people with exercise, I used to teach the warm-up. It came natural to me. I thought, what do I do? I said, okay, next thing. And I did personal training. I did the YMCA course. And then I thought, that's interesting, but I felt that's limited. And then I did my master's in sports science. Yeah. And then at the back of that, I got my first job in the NHS, which is still today. And they employed me as a clinical exercise specialist. And It was mental health in psychiatry. It was one of the biggest psychiatric, hospitals in Europe, And then working in psychiatry, I thought interested with psychiatry. I become fascinated with understanding mental health and what people. And I thought, I think I'm going to become a psychologist. And then I started and I did a psychology conversion at the end of that. And then with you to become a clinical psychologist.
Yeah.
And then, so I finished the psychology conversion, did that, and then I was waiting. And it's very difficult in this country to become a clinical psychologist because there's huge competition because it's paid for, the training is paid for by government and everything. And most of the people who apply for the training already got PhDs and stuff.
Yeah.
So I applied for the clinical doctorate, and then for the first year, I got a couple of interviews, I didn't get in, but most people wait for like 4 or 5 years to get in. My age was ticking. I was like, so I'm not going to wait 5 years to that. So I decided then, when I was working at the hospital, it was part of the physiotherapy department. And the physios always said to me, you should apply for the course. I said, yeah, okay. I always wanted to do it at the back of my mind, but because I remember when I was a dancer, when I was working at the Millennium Dome in 2000, in the show, it was my first contact with physio. And I remember the physiotherapist from Australia, her name is Caroline, I always remember that. First time she touched me, she said to me, oh my God, you're a healer. Never understood what that meant at all. What are you talking about? She said to me, oh, you're a healer. You're a healer. I was like, what are you doing? But I was really fascinated with her knowledge. And she also was studying TCM, traditional Chinese medicine, at the same time.
Yeah.
And her knowledge fascinated me. I was like, oh my God, that's what I would want to do that at some point. I wanted to do that. But then years, then take over, and I was like, okay, do something else. It was always back on my mind.
Yeah.
So when I finished doing the psychology waiting, I thought, I'm not going to wait 5 years. What do I do? And I said, let me apply for physiotherapy. At the same time, I said, I'm going to also apply to medical school. So I started doing the training for entry exam for medical school, and I see which one came first. And the physio came first, and it was paid for by the hospital, paid full salary, whole training, everything. I was quite lucky. Yeah. So that came first, and I did it, and so that's what I did, and then I finished that, and and that
Here we
rest
are.
history.
4 degrees in.
5.
5.
Yeah.
That's amazing. That's really good. What inspires or motivates you to further your education? Honestly, I left school without any qualifications. I only got inspired to read when someone gave me a book, and then I discovered actually I can read about what I want to read, and then I got offered opportunity to a level 3 qualification in personal training.
Yeah.
And then like you come across, as you start one thing, you get introduced to another area, and that intrigues you. But it's one thing to actually pursue it and actually go the hard route of degrees, walking out with the highest possible qualification in that field. Where does that behavior come from? Is that something is that upbringing, or is that something that's always been in you?
You see, you talk to different friends of mine from a different course, they all will come with a different answer. There was a bet when I finished that course, says, okay, we're going to bet which course you're going to do next, and we're going to start. Now, you know what? I always thought, oh, maybe I'm just lazy about working, you know, or something, or I don't know. I can't honestly say. I think
you enjoy learning.
I guess I must have done. Yeah. I must do.
Oh, 5 degrees.
It's I don't know. I think I do enjoy. I guess I do enjoy learning. I do, good or badly. I think there's a part of me that's very, you know, I like to achieve things, because I don't like to sit there doing nothing. If, for example, if I have to whole day not, you know, just watching TV, I can't do that. Or sit still, I can't do that. I feel I need to have done something that, you know, is progressing in life, whether you're learning something new, whether you are interacting with people. For me, it's all about that. And education is not just about reading, it's about meeting people, finding new things.
We were talking about that on the way down here.
And I found that sort of thing, you know, really, you know, is very fulfilling. I think I hate the stress of exam. I hate the stress, but the buzz that you get after having done it is quite. It is great. Yeah. So I guess kind of.
I was going to ask you, if you are so interested in or driven by productivity, for some people that is maybe looked at like an addiction, where you always want to be busy and doing something. So how do you manage to balance yourself out, and what do you do to stay still? Do you practice other forms of doing nothing?
Of doing nothing. You see, I'm very bad at doing nothing. I can't do nothing. You see, a lot of the things that we talk about mindfulness, meditation, and all these sort of things, you know, things that actually is very healthy. We balance people, feel centered. But, you know, I say to people, I have found my meditation when I'm doing cardio. Because I've gone through a lot of like physiotherapy training, where you have to do huge memorization. I mean, all the muscle, where it comes from. Oh my God, that's just mindful. It's just basically rote learning. And where I used to do that, I used to be on the treadmill or on the cross train every morning. Yeah. Paper in front of me, I wrote my notes, and I used to memorize. It was fantastic, and I got great grades from doing that. And then later on, I was discussing this with the process, because everybody's saying, where did you memorize? And I said, this is what I used to do. First thing in the morning, 25 minutes on treadmill, I would be memorizing muscles. Yeah. But when I break it down, it's actually a form of meditation.
It is.
Yeah. And for a lot of runners, as I got to know them and I talked to them, and it is a meditation. It is. And you can see people say, oh, people running for runners high. Yes, but not only. It's the way people switch off. People, you know, engage.
Have you guys seen the new movie Soul? Just to touch on that.
No, not yet.
Disney released a new movie called Soul. Yeah. And I've watched it with my daughter. And what's really interesting, just on that, he's a musician that's trying to break into a band that he's always wanted to be in. Mm-hmm. He's unfortunately in a car accident and ends up in, like, I don't know what, a plane of where souls go to and from. Okay. And there's a part in this plane where people when they're immersed in something,
Yeah.
it could be a violinist, it could be a pianist, it could be a practitioner, it could be a driver, it could be something. When they're fully immersed in apparently their purpose, they go to another place. And you can see these people, their vibration from this plane. And it's like we was talking about this last time. I feel at most relaxed and at ease when I'm fully in my workout and I'm fully involved.
Yeah, do you see, a lot of that's the thing that I've discovered with when I talk to other therapists and people like you were saying, that you go to a different place, you engage, different side of yourself. And interestingly, what with brain imaging and everything now, what we're discovering where we do tests and put people in those places, reconnect in that space, and you find different parts of their brain lighting up. And we try to really understand that actually what they're talking about is an actual physical experience that can be explained neurologically or through Western science. We don't fully understand it, but we can say what they're talking is not rubbish. It's not just, it's actually a different, something's happening in their bodies.
Yeah. I've actually seen some experiments done. This was a couple of years ago. And I was really interested in exactly what you were saying, because I was still umming and ahhing about whether to take up meditation.
Mm-hmm.
Like yourself, I'm so quick that I like to be doing things where I am almost psycho about being productive.
Yes.
And I don't know how to slow down. But to me, everything is normal pace, so time is relative. When you are at a certain frequency of yourself and you oscillate at quite a high speed, it seems fast to others, but it's just like if someone is stronger and someone is maybe physically weaker.
Mm-hmm.
So with that being said, what they were doing in this experiment, where they were taking people who were yogis or people who were really into meditation, and I had this book on how music affects the brain as a musician. So they had musicians, people in meditation, and then they also had people who were religious or had strong faith.
Mm-hmm.
What was interesting was that above the meditation, and it did light up the brain, music lights up the brain if it is of a certain frequency, so 432 kilohertz has a certain relationship. Then you had the people who had belief or faith.
Mm-hmm.
Didn't matter if it was correct or not, or however we want to see religion. Just their faith alone lit up their whole brain more than the other participants.
Including the musicians.
With music and musicians, it would be because they're exposed to sound, that's going to have a different, it's not just a thought process. So I don't even think those people could be counted as, it was only one study that I was looking at. My thing was looking at even the meditation and the people who had faith. And then as a separate, people who are musicians and play the instrument, while they're playing, it would be a light up, or if they're receiving sound, would be a different light up.
Yeah.
So that's a separate study in itself. But what you're saying with the brain imaging, so interesting.
Yeah, I mean, there's a lot of work being done more and more trying to understand these things. I mean, the brain is I have a quite keen interest in neuropsych and brain function and all the rest, partly because psychology, partly because mental health. So connected, it's about the understanding about brain function, because also what we are trying, neuroscience now is trying to kind of explain through the research and how the brain function work, trying to explain what things that we've been talking for millennia about what for example, when we talk about in psychotherapy or in counseling, we talked about that'd be a good example, things about what's happening in the relationship with people when you're talking the influence of power of words, of speech, and power of
Is it biofeedback?
Yes, but more, let me give you an example. For example, we talked about the when people are very aggressive, and they are very like impulsive and all of that. And in the Freudian term, we used to talk about the id, which is the primitive brain. So when you have a very active id, so the id is the impulsion like greed and hunger and all those things. And then we talk about the superego. The superego is all the moral thing, like don't do this, don't do that. It's like the good parents say, stop you from doing all the bad things. And over time, when neuroscience look at these things, and Freud talk about those terms about, and then we got the ego, which is the meeting point between the two. So the ego is the you. You are always in conflict between what your id is saying to you and your superego. And sometimes when you got an imbalance between the id, between too aggressive and you too impulsive, your superego is not strong enough to control, and therefore that's become more pronounced. I mean, I'm really simplifying things in terms of...
I think there was a book, a really famous book, and it's called The Chimp Paradox.
The chi.
The Chimp Paradox.
Chimp Paradox, yes.
Are you familiar with it?
I'm very familiar with it.
That we all have a chimp, and chimp is very primitive and it's very emotional and impulsive.
Exactly. So when we talk about neuroscience, we talk about the primitive brain, which is the limbic brain, which is actually about that. When people have got less the superego is more the cortex, the latest development, which is the gray matter. God. So which actually controls the id, and then we have the superego. So it's all that connection. It is actually neuroscience can see it. This is what is lighting up during this function.
Do you believe there's something above both those things, or do you think that's a compartment that we've been taught?
There are things we don't understand,
right?
Because there is the power of the suggestion, and the thing about quantum science as well, when you've got thoughts and beliefs changing the vibration of things, and all of that. Yes, absolutely. So there's something more than that. We are just more than just our bodies now. So the thing where I'm going with that is that although we have to talk about the confine of science and what we can explain for experiment and our understanding, there are those things that I do believe exist, but science hasn't been able to explain it just yet. It may happen in the future. I still have hope to be able to explain it, define it in the way they see, study, and explain things.
Because
it's just language. Do you see, the thing with, I remember when I was studying acupuncture, for example, and coming from the traditional Chinese medicine, and they used to, and the Western medicine just rubbish acupuncture because the evidence is not strong about it. Mm-hmm. Because they said, we talk about different points of the body, and they talk about certain points. I remember saying, this is like the fiery mountain of the mind or something like that. And I thought, like, what are they talking about? And actually, the term is psychosis. We use that in the Western medicine, and that's what they're referring to. So
how long has acupuncture been around?
Acupuncture has been there for millennia, I think. Yeah. But the problem is acupuncture is another thing because it got lost.
Just and overcomplicate it. Then is that what's happened? It's been around for years, but we just.
I'm just using an example to define the different language that it does exist there, but we haven't spoken in that language there in the terms. So Westerns say, we're talking about fluff, mountain, fire, and everything, but actually it's a metaphor. They use metaphor. It's a language thing.
So it's a lack of understanding.
It's lost in translation.
And there's they want to see the correlation under a microscope, and until science doesn't say this is psychosis, this is mental health, and put it in a compartment, the fiery mountain is going to be lost in translation.
Exactly, and because that's why they have. That's how I suppose this is how they explain it there. So they have a word for it, but it's more beautiful. Fiery mountain, psychosis. Do you know what I mean? So, but that's how, and that's what that point is treating for this. So, and that's I'm trying to refer this point as to, what we call auras, what we call about energies, what we call, we can't use that in a Western term because it's just like, what is fluff? But maybe in the future we'll be able to find some sort of, to be able to explain under scientific term what is happening physiologically.
Well, they call it biofield, so they say the biofield is maybe equivalent to aura. And do you think there's a danger where if we don't take these traditional aspects seriously, or even try and understand them, then you are missing out on a whole array of information?
The thing is, what I say, because I come across this sometimes in clinic as well, people come and say, they've seen somebody and they talk to this term. the way I approach it, I don't say to people, oh, this is absolutely rubbish. There will be a part of the profession, and if I stick true to my profession in terms of my training, this doesn't relate. I can't. What are you talking about? However, I need to look at the person as a whole and their belief. If somebody is saying to me, this is how they feel and that's a belief, I can't say to them, no, you're not right. How can I know? The person is experiencing something. It's their truth. But what I need to do as a clinician is try to make sense of it in a way I understand it without saying, oh, this is not true. This is not happening. I need to acknowledge the fact that, okay, I don't understand that. Maybe there's something in it. How can that relate to what they present or my understanding of life, of past experiences? And this is where I bring it all in. So I have to take that into account. It was like, okay, what are they meaning by that? Do you see what I mean? So I'm not saying I don't believe in it. I'd say I don't maybe speak in the same language of what they're explaining something. I might be able to explain in a way I understand that can make sense to me so I can help them.
Good.
Does that make sense? Or am I going?
No, it makes complete sense. So just for the benefit
Yeah.
of everyone in the room,
yeah.
What would you say your main job is? What would you? Because I know you're my physiotherapist.
Yeah, I'm a physiotherapist.
Yeah.
That's I abide by the all the ethics and the practices that's guided by my profession. Yeah. So this is
What so if your job title is physiotherapist?
Yeah.
You've got degrees in everything and beyond that's helped you contribute and perform even way better than probably another physiotherapist would. Not to discredit what they know, they do. They have their own way.
Mm-hmm.
But what would you say a physiotherapist's roles and responsibilities are, like you would any other job?
Our role and responsibility, Jenny, is try to get people better. Whatever they present, but it's how we do it.
Yeah.
So where we can treat people from various modalities. So we don't use at the moment. Although that's changing, they are giving our profession more and more and more responsibilities. We use not to use medication, but even that now we can prescribe. We start prescribing because we're cheaper than doctors, you see. So to get them to do us that, we do injection. I would see like in 5 years' time we're going to do minor surgeries. I can't see that happening. So where we can approach things through various ways, but we need to stick to what the evidence say.
Yeah. What I'm curious about then is because in my time in working in gyms, we've subletted to different professions outside of personal trainers and gym staff. I've seen osteopaths. Yeah. I've seen chiropractors and physios. Yeah. Again, not to discredit any other field, but is, in your opinion, a hierarchy out of all those? What else is there? There's osteopaths, there's chiropractors, there's physiotherapy.
Physiotherapy, sports therapist.
Right. Is there a hierarchy amongst those responsibilities and someone who encompasses them all or more than one or the other? Or are they all specific for things they can treat?
Look, they're going to be good osteopaths, they're going to be crap osteopaths, they're going to be good physios, they're going to be crap physios. I can't talk about, I have my views about it, but professionally I can't talk. Yeah. It'd be wrong for me to talk about osteopathy, chiropractic, and everything. And I've had people coming to see me and they've seen the whole gamut of things, even physios, and then they come to me and say, oh my God, that's been a very different experience.
But objectively, taking back in regards to what they specialize in and what they treat in, people, like you said, you can get a good receptionist and a bad receptionist.
That's right.
So the person behind the role is really what's going to make the role. Absolutely. But looking at it objectively,
I would say, put it this way: in the medical profession, generally, nurses, doctors, we are what we call HCPC, which is a healthcare professional. God, I can't even say what HCPC is. Basically, it's a body that regulates, practices, and osteopath, chiropractors, sports therapists don't come under them. Just physios just come under them.
All right. What's understood doesn't need to be explained then. Okay, we all got that. No, I'm joking. No, that's really. No, I've experienced all of them, and by far my experience with a physiotherapist has been probably the one I've left most satisfied with. And the other guys were really good, but it's just in case of if I have a shoulder pain or lower back pain, in regards to my experiences with different professions, for me personally, my experience with a physio has probably been the most satisfying or fulfilling.
And also, I met people who have said the opposite. So,
Right, okay.
who said, but again, because it boils down to the individual and experience. Because you have to remember, even as a physios, we train so many years, and then we have to specialize, because a lot of people, when I ask people, say they come and see a physiotherapist, most people think we're massage therapists. They're coming to see first for massage.
Yeah.
And then I said to people, and I said to them, do you know what? In my 4 years of undergrad training as a physiotherapist, 4 years, how do you know how much massage training I had? I told you, and that's
was it
3 hours?
Yeah.
3 hours in 4 years, and you think so? Just think about it. So we're not. But I've done additional training for massages because it's manual, therapy.
Yeah.
But that's what it is. So we're not really technical massage therapists per se. So our profession, a lot of people don't realize, we work work in ITU, we work in women's health, pediatrics, oncology, respiratory. It's massive.
Yeah.
We do a lot of chest stuff. We are the one that clears people's chest after after surgery. The first coming out of surgery. The first people that
you're the first point of call.
We're the first people to see, because we need to get people up as soon as they're coming out of surgery. So a lot of people don't realize how much broad profession is.
I was going to ask you that.
Yeah.
In that respect, I know you were saying what your roles and responsibilities are. Just getting people better.
Yeah.
Where do you? You kind of answered the question, but where do you fit in the broad? Let's call it the health industry.
Yeah.
Where do physiotherapists fit in? Because that's actually, if you're saying after surgery or anything that happens, really, the first person you're going to go to is the physio.
Yeah, this is where the role of the physio, I think, especially in this day and age, is really, really, the role is becoming bigger and more really important. Because, first of all, now a new role has been created, what we call for FCP, which is first contact practitioner. Basically, we are GP practices now, where people just go straight into physio, where they triage to a physio to get them fast-tracked into the ailment. So think about it. So it's not just purely physical that they will come and see these people. People could have a systemic problem that we need to triage them and be able to differentiate between all that. So anyway, we diagnose, so part of our profession. So so there is that, and then there is. Sorry, I'm losing track. What was your question again?
Where you place in the overall broad spectrum of the health industry.
That's right. So we have a big role where we can play, where we're educators, we are health professionals, obviously, but also fitness. Yeah. When it comes to fitness as well, we've got a big role there. So we can be everywhere, but I think the most important thing now, which should be focused on, is preventative medicine. Yeah. Where it's okay to be curing people when people coming with problem and everything, and I think physios can have a big role in that, because it's one thing where we assess, we diagnose, we treat, we educate, but we need to also prevent. Yeah. So I think that's a big role. Yeah.
What is the problem that you've noticed is the most common amongst people when they come to you?
The most common
issue.
God, is.
I mean, you're in a day. Let's say, look at it 2020.
Yeah.
You've, besides lockdown, open, you've been able to, lucky enough, practice where possible.
Yeah.
What's been the most common thing that's come across knocking on your door? Besides the insurance whiplash.
No, actually, I don't get any whiplash. Because of where I am, I get a lot of people coming with, just general thing like back pain and chronic pain, shoulder pain, neck pain. It's always kind of issue with mostly their joint, or that's my bread and butter. But what's different, I would say, is like their understanding of their condition, what they come up with. That's what's interesting.
The story of what led them to that.
And also now we've got a lot of YouTube and Google patient.
Yeah.
I mean, GPs are seeing that a lot. They're coming, they've looked up their condition online, and
let's touch on that because that would be an interesting point to touch on in regards
that's
to
something
pain
we
now
could
there.
talk about. This
What would you say? So someone is experiencing pain.
Yeah.
With the access to information,
Yes,
it's so convenient.
Yeah.
What if you're experiencing shoulder pain, back pain, knee pain, chest pain?
Yeah.
What would you advise that person in the moment to do? Contact a professional or do some research? I mean, from your point of view, because you're saying you've got the YouTube and Googlers.
It really depends on the person. Again, it's not such
I've
a black and white answer.
If I feel something,
Yeah,
I am not going on YouTube.
it doesn't.
Google.
I would say it doesn't help. It doesn't help to look things up. If you have an understanding,
9 times out of 10, I'm gonna die in 10 weeks.
Because it has there's something about expectation, and the other thing we call that the medical student syndrome, where you read something and you have it, and you think you have it.
Yeah.
That's medical students used to read up when they were studying about those conditions. And oh my God, I had this. Oh
By
my
the
God,
end
I
of your
had that.
degree,
Yes.
you're gonna have brain hair, heart problems.
And this is something that I see often. And then if a person suffers from, or generally an anxious person, or suffers from anxiety or from some,
Isn't there another word for that? Was it hypochondriac?
We can't use that. It's got a derogatory term, hypochondriac.
Of
course, hypochondriac. Call somebody who's from anxiety and just accuse them of you're a hypochondriac, meaning that.
So a hypochondriac isn't actually something that is in any medical books.
No, you don't. I mean, we use those terms.
Yeah, that's why we hear everything healthy.
Because you're saying when you somebody you're hypochondriac, is saying, oh, it's on your mind, you don't have it. How can you say that?
Right, okay.
Yeah, of course.
Okay.
And already you're not building a relationship. You're not believing me. They're going to walk out of the door and they're not going to be good.
So you're saying this, the belief in or potential belief that they are being exposed to, they're reinforcing.
Absolutely, and that's what's not good to look at those things, because you come in a condition and suddenly, although they might have something, now they're convinced that they might have something serious. Now you need to already try to convince them of their beliefs that not be right. Yeah. So that already is a work in itself, because it used to. How many times, and that's a big issue we have, like convincing people that they don't need an X-ray and MRI for their back.
Just the way you've explained that, I think I'm very much guilty of that. The amount of time I've got probably friends or family or PTs that I mentor, and they tell me they're stressed about this, and I tell them, I kind of, you're wrong for feeling like that. Not you're wrong for feeling that. I understand you're not wrong for feeling that, but your mindset or your perception of that is wrong. You should think like this.
Yeah.
So I think probably parents are probably more guilty of it than anyone else.
Oh, absolutely. God,
I think they just have the best intentions.
Yeah, the intention's there.
Remember what I said to you? The road to hell is paved with good intentions. And that's so true. I mean,
we can't bypass anything, is what you're saying. But also, I think with yourself as a personal trainer, with yourself as a physiotherapist, you both have different angles in how you are approaching their health or what they're coming to you with, and therefore you would stick to your corridors almost, because if you, Sharif, suddenly became the therapist, you would never be able to totally get them onto where you need them to get to. You want to make the most of the hour they're paying you for. Yourself, physiotherapist, it's actually part of the consultation process where you do need to know, because it's going to have an impact on how you get them better. Yeah. So you're both coming with different angles, but you're both driving towards the same goal.
Yes, to get somebody better. Absolutely.
Do you know what? I think personal trainers in the industry, so to digress from physiotherapy, personal trainers in the industry, especially with the way they're popping out like Skittles nowadays, because of the ease of the access to the qualifications.
Yes, I know. They're just
popping up out everywhere. I think a personal trainer should strive to further the education as much as possible, but really understand their limitations. And that's why when I started personal training in the same building as you, I already knew they were, and how you're going to improve your business as a personal trainer is by having that integral approach. And I will look at a client, I will spot a challenge that I don't specialize in. I won't do research. I won't go on YouTube and try to see what this person's wrong is. Alain, I have this client. Yeah. They can't raise their arms past their shoulders. I have an inkling of what the issue is. But can you do an assessment? And if possible, we will need to collab on getting this client to their goals in a safe and integral way.
Do you know, I say often to my client, it's a trial and error basis. I don't know. I don't have X-ray vision. I can't. I'm just going by what I see, what you're telling me. Now, so how many people have got the vocabulary, have got the intellect, and have the knowledge to be able to describe things? Already, you come in with a challenge, So I say to people, I could be wrong. We just try and find out, because that's the truth.
But has
No
that
one
made
can
you?
know.
Has
sure.
that made you?
Yeah.
It's almost like the things that they lack in terms of communication.
Yeah.
Has that then made you even more adept at tuning into someone's needs intuitively, mentally, physiologically, emotionally, maybe even sometimes spiritually, or whatever your own beliefs are, because you have such a wide spectrum of not only the mindset, but the practice.
Yeah.
And as you said earlier, someone said, oh, you have healer hands. And if someone on another spectrum has seen a different gift, maybe you've just utilized all of those things and they become even better and better because the lack of communication has made you better at reading people.
And that's what comes with experience and time. And I'll give you an example. Somebody came to me just between Christmas and New Year, came with her husband, and she's had some like shoulder pain and very stiff for like 3 weeks, which, judging by the history how it happened, I thought it was a bit too long for her to be in pain. And she sat there, she was telling me her story. I said, why do you hold so much tension? What's going on? Why are you so anxious about everything? Why you worry so much about things? Do you worry about things? And she just went and said, yeah, how did you read? How did you know? I said, I'm just looking at how you're sitting. And I said, I'm not surprised that you could. I said, okay, let's do a little exercise. I said, just breathe. She couldn't move her arm. I said, let's float this arm. There's nothing there. Believe nothing happened. Within the conversation, 3 minutes, she stood up and she said, oh my God, everything's changed. What has happened? Yeah. Tell me, how did you read? And I said to her, just to make it possible, I said, you're not the first person I treat. Just to make it simple. But
pretty soon you can be able to just do this, Alain.
Yeah, I've seen doctors coming and see me with back pain, couldn't sit down. Doctor coming from the hospital coming and say, oh, I couldn't sit down. Just talking to them, calming them down, trying to explain to them, because the next thing. At the end of the conversation, yes, it took 40 minutes. She could sit down and without much pain. She said, the most she could sit down. Goes to the power of explanation, the power of words. So, suggestion, of course, it's not just suggestion. There was something in it that I saw that actually I could explain, see, and make sense as well.
So on that, already you've explained, to go back to my initial question, which we didn't kind of get to the root of, is you're explaining two examples of people you've met. You haven't even put your hands on them.
No.
You've just got them to talk.
Yes.
Break down some barriers, relax. And already they've seen progress. So someone who is experiencing shoulder pain, back pain, knee pain, anything, they're becoming worked up about it. Yes. It's beginning to become an inconvenience.
Yes.
I know we've already established, don't go on YouTube, don't go on Google. What would you say that person's first step should be?
Well, the first, that's what we try. That sometimes can be a process in itself, trying to understand what we call the mechanism of injury or mechanism of pain. So how did the pain emerge? Yeah. And sometimes you could present with like a shoulder pain. And when there's direct trauma, something pulled or something, that's easy. That you can clear, there's been a trauma. It's when the people say, I'm not sure, this just happened. That's where it becomes a little bit more interesting and complex, because then you need to look at all the factors that can instigate pain. For example, it used to be, we know there's a great guy called Louis Gifford. He's dead now, great physiotherapist.
What's his name?
Louis Gifford.
Yeah.
He wrote a book about pain, and he was diagnosed with terminal cancer. So he spent the last six months, a year of his life writing this book called Aches and Pain, where he's talking about pain and generally his experience of things, and as a physiotherapist. And he mentioned something called a shopping basket as a physio. So what that means is, when you look at a person, you look at those different things, that different items in the basket that can contribute to the person's pain. So it could be stresses. It could be the stresses itself could be whatever, something going on in their life. The marriage is falling apart. They got kids.
Is stress killing us?
Stress is massive. I mean, we could spend time just talking about that in itself. I mean, that huge response to any big problem. But anyway, so we got stressors. We can have like a previous history of what has happened to that person, previous trauma. There could be physical components, and there could be a systemic problem. That person has got a degenerative issue, some blood problems. So all these things can contribute to that presentation. It's about identifying and understanding that there's all things. So that's what we call about the shopping basket. You need to look at all these things. You can't just look, oh, there's the shoulder problem. It's just shoulder problem. So it's complex.
Yeah.
It's really complex, but understanding all that. So somebody and one day could be, yes, it was just because of that point, but some days could be more that point, more the stresses as opposed to the inflammation kind of thing that's causing the pain at the time. So things fluctuate.
And just to touch on something, just to give a statistic out there, you saying roughly 60 to 70% of the clients you've come across from your experience have psychological issues.
Not psychological.
Not that they're
it's
insane.
It's part of. It affects what you present with.
So then, in what turn do you become a therapist? Because that must be a huge element that you're facing, becoming almost like when I'm personal training, a huge part of my job is the relationship I build with this person.
Yes.
I want to build a relationship with this person because I want to be able to get them from point A to B and know what triggers them and keep that why and that emotional connection to why they're lifting this deadlift or why they should turn up on time or why they should commit. That then in turns into me, that person sharing their problems with me.
Yes.
I have to not burden these problems, but champion these problems and somehow become a different perspective every time.
Yeah, you become a therapist because what's happening is you build in your own way what we call a therapeutic relationship with your client. So therapy exists in various guises. Talking is therapy, exercise is therapy, putting your hand on somebody in a nice way can be therapy, or it can be the other way. Yeah. So it's all these, this is partly why we're social creatures, because into our relationship with each other, there is a therapeutic, unconsciously sometimes conscious alliance or dynamic going on.
And do you think in this time that we're in, a lot of that therapeutic interaction, which is not the same as through a phone or a computer, with the rise of isolation, this is going to really bring to the surface how many people who have already been struggling are going to be struggling even more. And does that worry you to a point, or do you think with your current beliefs and you saying how important that one-to-one human interaction is, technology could never replace the aspect of actually seeing a human being face to face?
The thing is, it's interesting because, with lockdown and everything, telehealth have emerged quite a bit, like our profession, we're seeing people, and there are a couple of research that's coming out recently that says it's as effective and it's very effective and all the rest. Research can be biased. I mean, I've got a question mark. I think it can be effective, but I don't think anything will replace human contact in that way. Yes, technology, for Zoom and everything. I mean, I know a lot of even psychotherapists and stuff, psychologists are using that. I think it's good and it's better than nothing, but it's never going to be the same experience as being in a room with someone and talking to someone. It just can't. There's too many elements that's not present now. But it's better than nothing. It's human. It's talking. It's being engaging with someone can be is helpful. So that's where it comes to technology. Can be helpful, but is it going to replace that? I don't think it can replace it 100%. No, not in my view anyway. It's not.
Talking about what we kind of touched on before, there's a lot of things that we say now in the Western world that we're using in a very Western narrative, but there's things that have been going on for 1,000 years, just done in a different way, or things that were used to be done that we're losing touch of now. what some of the technology, what sort of technology are you excited about to come in that kind of replicate what's always been there? I'll give you an example.
Yeah.
Probably sports massages have been happening since the dawn of time.
Yeah, and now we've got the
With the
massage
Theragun.
gun.
That's when I saw that, I was immediately like, wow, I want one of those.
Yeah.
You know.
I use it too.
Yeah.
I mean, you know, I've used it. Is it so? Do you know?
Yeah, let's do that debate.
Yeah.
The sports massage versus Theragun.
Yeah.
You know, what's your thoughts on that? And being YouTube, Google, Theragun, the accessibility of it, the convenience of it.
Yeah. Does it do the exact same job? No, it doesn't. First of all, if you just look at the vibration, you know, even our nerve endings, our receptors, we've got different receptors that detect a different input. For example, vibration go for a different nerve as opposed to heat, as opposed to touch. So just because of that, it's got a different input. So it's not the same. Yeah. And even the massage gun, for example, when you put hands on someone, you generate heat. Massage gun doesn't. It's just
cold.
It's just cold, and it just simulates vibration. So I said to people, they say, what does that do compared to massage? I use both. First of all, I like to feel things. You can't feel things with a gun. I like to feel what's happening to the texture of the tissue, how it feels to me, and also how sometimes, I mean, physios will kind of like crucify me for this. When I put my hand on someone, generally sometimes I let my hand speak to me.
Yeah. Do you know, there was a person. Do you remember the personal trainer we had? He was quite an LD fellow. It's very slim.
Yes.
Like the BFG.
I remember him.
I can't remember, but he basically backstory is he used to train people solely in the forest or parks, and he was very. I remember I had a meeting and I had a team meeting, and I said to him, "How's everyone feeling?" We ran around the table. Everyone's like, "Yeah, I'm feeling good. Had a good weekend. Yeah. I spent some time with the family. We got to this PT. Yes, this morning I feel my inner warrior is nice and out and everything." But the reason why I employed him as a personal trainer is because I liked his approach. It was very different.
Yeah.
He was qualified. He was mature, and he had this aura about him as well that we were speaking on before.
Yeah.
And he said one of his approaches, he finished this, I think it was a Chinese remedy course where he would, if someone had a pain in their chest, he would just put his hand on their chest, right? Not only this, he put his hand on their chest and he would yawn. And something to do with the meridian lines. What is it? The
chakra?
The chakra. Him yawning, every time he felt the compulsive yawn, was the pain leaving or the issue leaving.
Yeah.
That's really interesting. But this was going to be my question about Reiki, because it sounds
that's
a lot like
that's
Reiki.
what Reiki. Yeah, so I was going to say it's like a form of
Reiki.
It's a form
So
of
it could have been that, but just to touch on that,
Yeah.
what you just said, to expand on that, you put your hands it and that feeling.
And that it's different. It's something happens, and I mean I can kind of like explain it with my some scientific explanation that can justify what is happening.
Yeah, let's do that.
I mean, it's too. We can't do that.
You can't summarize it in a nutshell.
Yeah, it's just.
It just works.
It'll be a lot of jargon talking about action potential and ions and stuff like that. It's not the time for it. And also, power of touch. So talking about massage gun, and I say to people, muscle, it will respond to different sort of vibration and stimulation. And the vibration is just different input. And the body likes different input, and it can have different impact. And if you respond, again, the power of belief, if you respond to it, it's working. The main thing is not causing harm. If I just need to be clear in my mind, I'm not causing harm. So whether I do good or it works, that may or may not happen. But I must make sure I'm not causing harm. That's the main thing.
Kind of almost links back to everything we kind of touched on, that mind-body connection, that psyche side and that physical side.
I was just going to say, echoing on what you both said, is it will always come down to the power of the belief that they bring. And if they come with a completely low view and the trauma is there over years and years, and on top of that, they can't communicate it with you. It's almost like they will need a multi-dimensional approach from different agencies, which is kind of outside of your control.
Yes.
But you will work from your aspect.
Absolutely. And so many times, like some client we talked about before, come to me and it's some shoulder problem, and we got talking about things, and obviously his issue, there's a lot of psychological thing going on there, and so I was talking about the physical element, obviously discussing all these things, and he sent me a message the next day. He said to me, when I got home, I just couldn't stop crying from the thing. I said, I couldn't believe that you just saw straight through me. And he said to me, can we carry on therapy? I would pay you to carry on therapy. And I thought hard about it, but I'm not I'm not a therapist. And
Again, come to that point, know your limits.
Exactly. And I said to him, come and see me the next time. So I sat down and I see him the next time. I said, look, and then I needed to contain him because he found something talking, so he wanted more of that help. But I knew also the limit of what I can do with ethically, and also my training, because this person has baggage that I could contain to a certain point, for my own self. So then I had to explain that to the person. I said, yes, this is my limitations, and I think I could refer you on to the right person that could take you on that journey, and that's what I did. So I contained him, and I said and I referred him to the right people.
That's really healthy.
And that's what people absolutely. And even the physical, I said you would benefit from that, and that's what I refer that person to you, because I also, as opposed to the trainer, I know them. You as a person, I'm sure you would fit that person most. Because I said to my clients sometimes, I said, you might come to me, I would try to work together, but I may not be the right person for you, and that's okay. But you need to tell me that. It's fine, because I don't expect to be able to help everybody. It's not normal. Not everybody can help everybody. Some people respond better to things.
Going back to you said, some people they prefer the osteopath they saw before. And
that's fine. And somebody would say to me, "Oh, that's what they've done, osteopath." And I said, "Okay, that's fine." I said, and sometimes I say, "Oh my God, what the hell are they doing?" But I would say that to that person because they might have a good experience. And I wasn't in the room. And what the person is saying to me is their version, is their understanding. It might have been different. I wasn't there to experience. So I need to accept that, but and professionally, even if I don't believe and I think it's all, and I have to say to the person, okay, this is what you have done. However, this is the angle I'm going to approach it with. They have their, they had their clinical thinking of that, but let's try that. You may or may not like it. The best thing to do is to give me feedback, and we can try to see what we can take from there. But it's important for you to understand what is going on. In my view. So
I want to get through some quick punchy things to make sure that anyone watching this is going to get value and maybe clear up some misconception, or we can debunk things, or bring something to the table that we never met before, they never heard before. So things that I've only experienced when I'm working with you and my issues, which is just general maintenance really from training hard, is can we talk through the benefits of a few things? So one being dry and wet needling. Like when would someone need that? What are the benefits of it? What are the benefits of it?
Yeah, it's a very contentious issue at the moment in the physiotherapy world, because there was about 5 years ago the recommendation, the guidelines were like dry needling acupuncture was recommended for back pain. A few years later, they took it out. They say because there's not enough the research is a bit is not strong enough to recommend it. Where do I stand on it? I use it in practice, but I have to stick to what the evidence say. What the evidence says, and also what anecdotally or from my clinical experience, what I use it for. I have to be very honest with my patient. I said, I'm not using this needle to cure your alopecia, your hair growth and things like that, or your fertility issues. I'm using it very much because I have seen that sometimes when people
trial and error
for that problem, for the tightness of your tissue, it helps the tissue relax much quicker than you are able to do by yourself, or if I put my hand on you. For some reason, that seems to work. And that's what I use it for. So I won't pretend to be about. So for these things, for me, from my experience, they work. They help people relax, and you can see the tissue, the stuff. It may be just simple because people, my needles, I need to relax there, and that's what happens. Who knows? I can't tell you 100%.
From my experience,
yes,
I've only done it once with you. I had a knot deep inside my shoulder. We was working on it.
Yes.
He was going to town, the thumb iron, everything, the elbow. He brought out the Theragun. I thought next after that, I didn't know what was going to come out after that. The way he was bringing out tools, everything to get this one knot. The moment you put the you cut it. You needed it first. The moment you put that needle in, there was that slight. Yes, literally.
This is the other thing that I find needle works very well. And again, it's very contentious because people say it's probably even there was a term we used to agree on, or people recognize, called that trigger point, which is like a toned bend that tend to happen. You see, that's happened always in physios and medicine all the time. There's always new things coming out, and they always say, "Oh, this is rubbish. This is good." What we used to do in physiotherapy 3-4 years ago is very different now. You know how we used it because of research and everything. So again, with acupuncture, for example, I use that needle for trigger point. I have seen very often people get told, if you get the right point, it just you can't feel the pain anymore. I can't say this is why it works, how it works. I just know for this time it works, and I'm not causing harm by doing that. I like your experience; it works. So, people argue and say, "What are you talking rubbish?"
Did I say it right? I said dry and wet needling.
Wet needling. When you do
is that a thing?
Yeah, we don't call it.
I think I meant dry and wet cupping.
Cupping, maybe you meant cupping. Yeah, because
just for the YouTubers in the comments.
Because that's what needling. Because sometimes what we use the needle for, sometimes some people call husha, something where they put heat and put herbs on it. That's TCM. I don't do that, and I wouldn't want to comment on it. Really. Yeah. And sometimes we use needle as a transfer for electrostimulation. Yeah. Sometimes we put that to get current in. Yeah. I've used that as well for them in sports to reduce pain, to work with pain. It's a pain modulator. Sometimes for muscle activation, they use that as well. But I don't use that very much in clinical practice. But for what I use it, tissue relaxation, and I use it for what I call trigger point or tone bend, and that works. Yeah.
So I touched on it just a second ago. Cupping. I mean, to be honest, when you see, I saw cupping for years, and it just infatuates. It's like it's like watching someone pop a spot. It's so you just can't take your eyes off it.
I know. You see, again, that's another very contentious issue. The research and the evidence for it is really poor. Mm-hmm. But people use it and it works. So is it power of persuasion or something? But from my clinical experience, it works well when people had trained very hard, and it seems to, in my view, help recovery. Yeah. I can't say any more than that. I do use it, but I don't use it for everything. Like, oh no, that's not. Yeah. Generally, if somebody doesn't come with things, I think there's nothing serious or severe, and I'm worried about, then there's kind of safe treatment. And people, it's a bit of a fad. People like, oh, what's fashion about the last Olympic? It was all cupping. Before that, it was all taping. But the evidence are not that strong.
Yeah. I've answered it, but have you got any?
I know we could talk for.
Do you know what it is? I think off the back of this, we're going to need at some point a part 2.
Well, we need to choose our topic because we can digress. That's the thing that nature can digress with so many things.
I think this was just a general introduction. I want people to get from this is an introduction to a physiotherapist and their broad wide of knowledge, their ability to help people with a variety of issues, their importance. From my experience with you, I now hold physiotherapists very in high regard in regards to where they stand in the health industry, and I wanted just to share that experience with people. And where can people get in touch with you?
I've got my website, which I've got it's ACE Physiotherapy Bethnal Green. It's ACE, which stands for my name is Alain, and then it's City and East.
I'll make sure everyone has a link.
Yeah,
when they watch this.
So that's where got my information there. One thing I quite enjoy is I like to educate and teach people. I think that's very, very important. You know, that's why when I work with people, for me it's so important for try to understand. I said to people, if you don't understand, if you leave this clinic here, you don't have an understanding of what is going on, or if we don't understand, that's clear. At least you know that we don't understand. That's also important. I haven't done my job.
Yeah. So I think off the back of this, people watching this, my DMs are gonna flood with ask him this, ask him that. So you're definitely gonna come back by demand.
I'm curious by nature. I like to kind of, I used to like to solve puzzle, and that's one thing I was like, because sometimes I have patients that something I'm not clear, and they've left the room, and I was like, this doesn't quite make sense. And sometimes it's.
Well, that's what I think that's what makes people great in their profession, because
it's like if it doesn't make sense, like what's going on? It's like when you train somebody and you find the muscle is not progressing, doesn't that. You think they're not going anywhere.
It's jarring. It's actually so infuriating.
Exactly. It's just like for me.
Or when I'm with a client and they're just not losing weight, or they're just not building muscle, and you have to constantly ask them questions. You have to go back to the drawing board.
Yes.
And I do not feel content until we find, this is progressing. This is going in the right direction.
You're speaking my language.
Yeah.
Unless you're going the right way or making sense, or but the other thing is, it's only when things are not working and stuck that you learn the most.
Yeah.
Because it pushes you to ask yourself more questions. It pushes you to go back to basics. It pushes you to ask the fundamentals. It really pushes you to think laterally. And this is where I say to people, mistakes and failures are the biggest learning opportunities.
100%.
It's when you succeed and things going well, you don't learn as much.
I think a famous quote is you have to fail forward, which is
I like that.
You have to fail forward, and that's one of the best things. Is try bigger and better things, and if you're going to fail big.
Yeah, I do like that.
And I think that if you have an innate something internal, which, like you said, you're curious by nature and you like puzzles, and if you're quite inquisitive and you're curious, I think these professions where you get to be in communication and contact to improve people's lives, those are the type of people who should be in those professions, because your research and obsessions or inquisitive nature is you're almost doing a different type of surgery in on the person, whereas if a surgeon who is ultimately could kill you knows nothing about you. And I find that really ironic.
Yes, that's the whole thing in the profession. We talk about that. Surgeon, it's the whole
amazing. Alain, absolute pleasure. Thank you so
it
much.
It was my pleasure. Thanks for having me. It's been great. It's been awesome.